Well, good morning, everyone. Here we are today, and we are going to do our workshop, which we didn't get the chance to do last week. And so it's good morning, not good evening. My name's Paul,
Oh, good morning, everyone. This is Bev.
and we have a great workshop today. It's on postpartum care, and specifically, it's about postpartum depression. And we did an interview with Dr. Nancy Aton. Uh, I did it last week, so this is pre recorded with her. And then Bev is going to teach the points while I play Mr. Techie
Oh boy.
in the
Lucky me.
background. And so, if you have any questions throughout, you can comment in the little box there. Uh, Dr. Nancy said that we could share with her any of the questions we had. There's also going to be information about where to contact her. So,
Wonderful.
without further ado, for that, we'll spend the first 20 minutes listening to her presentation, which is loaded with good information. Good evening, everyone, and we have a special guest with us today, Dr. Nancy Aton. Did I say it right there?
Good, you did very good.
We appreciate you coming and sharing with us, Dr. Nancy, and we're going to talk about postpartum care and specifically, I guess, postpartum depression. And Dr. Nancy is a naturopathic physician here in Tucson, Arizona. So welcome,
Thank
Nancy.
you. It's great to be here.
Yeah. So what we'll do is just let you take off and do your presentation.
All right. Well, I'd like to say that I did home births for 26 years, delivered or helped deliver over 1,000 babies, and that was from about 1980 or 1979 until 2010. I realized as I got older, I didn't want to stay up all night anymore. I needed my sleep. So we're going to talk about postpartum depression, as Paul said, but I also want to mention that there are some other issues that women who have been with, like hemorrhoids, pelvic pain, heavier bleeding, stitching pain if they've had stitches, if they're breastfeeding, sometimes sore nipples, mastitis, which is a breast infection. So there's a myriad of things that can happen, and of course, giving birth is a big stress. It's a life-changing event, and it can sometimes be difficult for the mom who just gave birth and her partner and family. So we're going to delve into postpartum depression. I wanted to give some data. In the United States, there are about 600,000 cases a year of postpartum depression. About 10 to 20% of women develop postpartum depression. Most obstetricians are screening for it now in the third trimester of pregnancy, which is the last 12 weeks. It's interesting that about 20% of postpartum deaths are due to suicide. That was a very interesting statistic to me, that if postpartum depression goes untreated or undertreated, it could lead to suicide in about 20% of the women who develop it. The biggest age group that gets postpartum depression the most is between 35 and 40 years of age. That was interesting to me too. And men can also get postpartum depression. So we'll talk a little bit more about that as I go through. I just wanted to give some data. There's also something called postpartum psychosis, which is very rare, luckily. I've seen one case of that in my 26 years. That happens in about 1 to 2 women out of 1,000. So that can be very serious, can cause hospitalization if it's not treated. Some women end up, unfortunately, harming their babies with postpartum psychosis. Okay, so the biggest risk factor for postpartum depression is if you've had it with another pregnancy. You have a 46% or 46 time increase in getting it again. So 46-fold increase if you've had it before. So to me, that woman would be on high alert with her midwife or obstetrician, should be looking for the signs, making sure that she gets the help she needs. 1 out of 5 women suffer in silence with postpartum depression. They don't get help. They don't tell anyone. They try to hide it from their family. I think that's probably because we still have somewhat of a stigma with mental health issues. Sometimes people feel like they're weak, or why can't they just snap out of it? So it doesn't always happen that way. So let's go through the sort of, it's not really a continuum, but we have to look out for the baby blues, which happens to a lot, like 80% of women get the baby blues. That usually peaks on day 5 postpartum, so 5 days after giving birth, and usually it only lasts a couple weeks. So you want to know that they are having the baby blues, so you can watch the time frame to make sure somebody doesn't keep saying I haven't come out of this, I'm still suffering from crying spells, I don't feel my normal self, I feel anxious, I'm irritable. So you would just want to keep an eye on that. Luckily, most doctors and midwives that deal with birthing mamas see their clients at 2 weeks. So that could be a time to screen for postpartum depression, or to see it, make sure it's not getting worse. The baby blues aren't getting worse, I should say. So baby blues, mostly it's crying. A lot of women say, I don't know why I'm crying. I don't really have a reason to be crying. I'm just crying. And again, people can get irritable. People can be snappy with family and friends. And most people can understand that it is a big change of events. It's a big lifestyle change. You're welcoming in a new person. So we just have to make sure that the baby blues don't progress into actual acute postpartum depression. So the most important thing for the baby blues and postpartum depression is support. Making sure that you get support from your partner, from your family, that is to say if you have a partner, but hopefully family members, to make sure you get some sleep. We know that sleep deprivation is a big risk factor for postpartum depression as well as depression. So it's very important for that new mom to have the opportunity to get adequate sleep. If she's breastfeeding, it might mean that she needs to pump some milk so that another family member or partner can feed the baby at night, so that she can get some uninterrupted sleep, at least 4 to 5 hours of uninterrupted sleep. It also means being able to feel that you can ask for support. Some people think they can do it all, and we really need support, and it's okay to ask for support. So that means having people cook some meals or bring meals over or help run errands. You go to the post office, go food shopping, come into the house, do some laundry, clean, help with any older children that might be around. So that's very important, so that the mama and hopefully her partner, although usually somebody has to keep working, so that you can get the rest that you need after giving birth, and that you should actually, the mama should act like a baby. She should sleep and eat and pee and poo, and that's about it for the first month or so. So postpartum depression, again, more crying, more irritability, oftentimes anxiety will pop up big time. A lot of people say that depression and anxiety are just two sides of a coin. They're very intertwined. So some people, get concerned about, am I going to be a good mom? Am I a good mom? Why do I feel this way? I can't be a good mom if I feel this way. So it becomes a vicious cycle that women can get into, feeling bad about themselves. Another big risk factor is a thwarted expectation about how your birth is going to go. So let's say you plan this wonderful home birth, you're going to have candles and incense, and you're going to have a doula there, and you're going to get massage, and everything's going to be wonderful, and you're going to have a baby in 10 hours, and everything's great. Well, what if that doesn't happen? So what if you plan this wonderful birth and you end up having to go to the hospital with major interventions? What if you end up with a C-section after you've planned this wonderful home birth? That could cause a lot of upset. And unfortunately, sometimes people blame themselves for, how come I couldn't do this? How come I couldn't just pop a baby out? Why, why me? So that can cause some depression too, thinking that you're a failure, that you just didn't do it right. Now you had to have major surgery if you had a C-section, you had to go through the Western medicine show, I used to call it, which doesn't mean it's bad. It just means that you had different expectations. What if the baby has to be hospitalized? What if the baby gets an infection? What if the baby gets jaundiced and has to stay in the hospital? So these are all things that could lead to depression. You don't get to take home that baby right away. You don't get to go home right away. So you're in a different situation than you expected. So it's really important to talk that out and to not blame yourself. I try to tell my patients, please, you have to make space for every possible outcome when you're going to have a baby. And there's a saying that what you resist persists. So if you hate hospitals or hate Western medicine, sometimes the universe gives you a little lesson. Like we have to embrace it all. Fortunately or unfortunately, we just have to accept that it's going to be whatever it's going to be. You can plan all you want, but sometimes unexpected things happen. So again, with postpartum depression, there are many different risk factors. Again, having a family history of depression yourself, or any family member having a history of depression or postpartum depression. If you have a poor diet, especially if you're low in vitamin D or fish oils, cruciferous vegetables, that's broccoli, cabbage, cauliflower. I'd like to be in Colorado right now with this heat. Anyway, cauliflower, Brussels sprouts, radishes, kale, things like that can contribute to some depression. Also, adverse childhood events. They're called ACE. So anybody that's had a lot of trauma in their childhood, sometimes that gets stirred up postpartum. All of a sudden, you're a mom, you have a baby, you want to take care of it. They can just swirl up that trauma that you may have had. So adverse childhood events, what are they? So any kind of abuse, emotional, physical, sexual, bullying, witnessing domestic violence. Maybe you've witnessed your parents hurting each other. Parents with drug or alcohol problems that don't exactly behave themselves when they're under the influence. Food scarcity or food insecurity. You don't know where your next meal is coming from as a child. You've been maybe malnourished, aren't sure, what's going to happen. Those are the main adverse childhood events. So it'd be nice if they were screened early on in pregnancy. I think some doctors are starting to do that. Have you ever had this experience? How did you deal with it? Did you ever get help for it or therapy? So it's important to address those concerns if they do arise. So back to acute postpartum depression, increased crying, increased irritability, anxiety. Sometimes you may be concerned that you might hurt your baby or hurt yourself. If you have any feelings of suicidal ideation, that needs to be addressed, especially that one, because death is not an option if it can be helped. And it's very interesting that men get postpartum depression. Oftentimes it starts about 3 months postpartum, so the baby's 3 months old, usually 3 to 6 months postpartum, and often that is due to a lot of circumstances. One is if their partner, the man's partner, has postpartum depression, he's going to be affected by that. And also if the male is working while the mom has time off, he may be starting to feel overwhelmed with maybe having to take on a lot of household duties in addition to working. So that could be a big issue for men. Also, if they've had a history of depression, that could impact their postpartum depression. So again, it's really good to express those concerns. Try not to keep it inside. Make sure you get the help you need. And also men can react, of course, to an adverse outcome that was not expected. If their partner is in pain, having a difficult time with the birth experience, any kind of traumatic birthing experience, or if the baby has had some trauma or needs, like say the baby needs heart surgery on day 3 of being born. That is going to be a big challenge. And then we also think about the couples, if they don't have family members in the area, that can also be a stressor, or they don't have support. So lack of support for men too. Financial stress can be also a big factor with male postpartum depression. Feeling like, what am I going to do? I have this new being. We have hospital bills coming in, things like that. Also malnutrition, drug or alcohol abuse could also be a factor. If the couple doesn't get along, that could also contribute. So to me, good communication during the pregnancy. I have to say that I have seen times where the male, and no offense to any males, and this is going back, 30 years, didn't want to be involved with the prenatal care so much, but part of that is because maybe they're working, to support the family. Maybe a little bit nervous about going through the birthing experience. And some men have expressed to me that they feel a little bit helpless when the woman's in labor. I don't know how to make these contractions go away. If she starts, howling, I'm not sure what I'm supposed to do during a contraction. So it can be a little scary for people, to be around a birthing woman and not being sure what's going to happen, what it's going to look like when a baby's born, and dealing with the placenta and the blood and stuff like that. So to me, the more you communicate about what that experience is going to be like, the better. And the other thing is, if you haven't been around children, let's say you're both only children and you didn't have any younger siblings, or you weren't around babies. I used to tell my patients, try to find a friend that you can babysit their baby so you know what it's like, or you can be with them while they're taking care of the baby during different stages, like go when the baby's newborn, go a month later, see if you can hang out or hold the baby or get used to what that's going to be like. I used to always laugh at the parenting magazines or birthing magazines. Everybody's always happy and smiling, the baby's not crying, they're all wearing white like nothing's going to get on it, and just presents kind of a not normal viewpoint of what it's really going to be like. You don't see a magazine picture with the baby puking over your shirt, and going, yeah, I haven't had any sleep for 3 days. Here I am.
Yes.
So again, the expectations, we need to talk about realistic expectations for birthing and afterwards. That's why I wish in this country, we had what they have in Europe, that a nurse comes to the house every month to see how mom and baby are doing. They do wellness checks. That would be wonderful if we could have that in this country. So so I'm going to talk briefly about postpartum psychosis. So this is very serious. This is when women start having delusional thinking. They start worrying about their own physical well-being or the baby's well-being. They get obsessed about something that usually is not serious, like a rash. They may obsess about it, think it means, oh, this baby has syphilis, or I know there's something really wrong with my baby. The urine is dark, or they just get very concerned about the health of the baby and themselves. And also they can also have feelings of wanting to harm their baby. So that can be very disconcerting to family members. Also, they can be very disconnected from wanting to take care of the baby. And oftentimes they don't want to be near the baby because of that fear of hurting the baby. And oftentimes they are so down that they can't get out of bed. They can't perform activities of daily living, so somebody else has to take over. So that can be very hard on the family unit, for family members, witnessing their daughter being very distressed and very mentally unstable. This is where you can hear about the stories of people actually harming their babies because they're in that psychotic mode, if you will. Most of these women need some medication. They may even need to be hospitalized to help them get back on track. All right, let's talk about some treatments for postpartum depression. So it's very important, I've already mentioned, that people eat a healthy diet as much as possible. It's really important for the mom to let people know what she can and cannot eat, what she will and will not eat. If somebody makes a spam casserole and she's a vegetarian, that is not going to be helpful. So very important to lay that out, like, and even make a schedule, even during the last few months of pregnancy, like so-and-so friend can make this on this day, you know, try to get maybe 5 people to commit to bringing some food over, or family members. Also, it's good for pregnant women to, you know, make some food and freeze it. Some tasty, healthy, nutritious food. Good to have healthy snacks like nuts, seeds, fruit, Greek yogurt because that's a lot of protein. Making sure you're drinking lots of water to stay hydrated. So that's important. It's also important with postpartum depression to possibly check for some things like thyroid. Is the thyroid working properly? It's good to go to your doctor to get these evaluated too, to see if that's causing anything. So low thyroid, get your iron levels checked. That low iron can contribute to depression. Low vitamin D levels can contribute to depression. So it's important to check those to make sure they're in normal range. So aside from that, what I find is really helpful on the more naturopathic realm, if you will, is a progesterone, natural progesterone, because our hormone levels go down after birth. They've been ramping up from the day we get pregnant, and then they start going down. So progesterone, hear the word progestation. Progesterone is necessary to nourish that little embryo until the placenta takes over. So progesterone differentiates the uterine lining. It changes it so that it has a lot more amino acids and glucose to provide nourishment to that embryo. And also progesterone is very anti-anxiety. It's anti-inflammatory. So it's important to keep those levels normal, if get them back up to normal if possible. We don't totally understand why some women just drop their progesterone really low after birth, and others it's more gradual. So progesterone in an oral micronized capsule. Micronized means it's put into oil, usually olive oil. You want to avoid the nut oils because some people can be sensitive to nut oils or allergic. You take 50 to 100 milligrams at night or in the evening. See if that helps. For anxiety, especially if a woman is breastfeeding, you have to be very careful about what you're taking in. So I like to use glycine, about 5 grams of glycine. Put it in a cup of passion flower tea. Stir it up, because glycine is what you find in Jell-O, like Jell-O that's not, it's the main amino acid in Jell-O. So you can get unflavored gelatin, which has glycine in it. So that can be really good to take 5 grams in a cup of passion flower tea twice a day. Can really help with anxiety. Also, skullcap, passion flower, lemon balm are also good teas for anxiety. And also BioTouch. I think BioTouch would be really helpful for women with postpartum depression, anxiety, help with relaxation. Some people, feel very nervous about leaving their babies with other people because of that attachment and feeling like maybe they have to worry about, is that person going to, do the right thing? So I think BioTouch would be very helpful, if the anxiety set, the depression set, relaxation, helping women to, calm down, to be able to go to sleep, to be able to fully relax, to get a good nap. And my rule is to, really, like I said, mama should be sleeping when baby sleeps if they can, not feeling like they have to get up and, do chores around the house. So I could see that BioTouch would be very, very helpful in that arena, helping balance the hormones. helping women get back in balance, helping balance any kind of bodily pain from carrying that baby around for 9 months, any low back pain, or being in labor for a long time. You can imagine the pelvic floor feels like it's non-existent. People can feel, what did I just do? What just happened to me? Why does it feel like I can't tell one opening from another down there because I've, given birth? So I think that would be very, very helpful. I'm imagining, since I'm not a biotouch practitioner, but I value it very much, is maybe twice a week or maybe more, depending on what the woman's symptoms are and how complicated her situation is. I would also think that with the baby, it would be good too.
Right.
Do I have time to talk about one more thing or no?
Yeah, go ahead. We got you.
Okay, so I do want to say that if a woman does not benefit from any of the things I just mentioned, there has been a drug that was approved by the FDA for postpartum depression last year. I need to look at my notes for a minute to pronounce it, if I may. It is called brexanolone, just FYI. So I wanted to talk about toxic positivity. So this is when you exacerbate positive emotions, but the danger is that we're not meeting the patient where they are, the person where they are. It's almost like eating too much ice cream. You eat it and eat it and eat it. Oh yeah, it's wonderful, but then all of a sudden you don't feel so good. So that's why, to me, it's very important to meet people where they are, and that it's okay to not be okay. So it doesn't work to say snap out of it, or just get over it, or you should be grateful for all that you have, or what's wrong with you, or you're so lucky to be where you are. Why do you feel this way? So those are not helpful. Just important to have a lot of compassion and honor the person wherever they are.
I really appreciate that ending of it, of accepting where people are at. And I get that sense from you as you work with people is, hey, this is what we've got to work with. And I appreciated that you even said some of these things you can't even tell that they're going to happen, but you're not a bad person. You haven't failed. And that's such a nice message.
Yes, we're all human. We're all trying to figure it out. There's unexpected things that happen in life all the time, and we have to make the space for it.
Well, I'll tell you, you gave us a lot of good information. I know some women who are pregnant at the moment. I actually have a dear friend who had a lot of those complications, went in, wanted that birth, but ended up in the hospital for, 2 months. The baby was incubated into, it was a mess. But so appreciate what you do, and I appreciate you mentioning BioTouch or any of these kinds of touch therapies. I noticed in your paper here you talked about therapeutic touch, massage, those kinds of body work. So for all of you out there, you've got the contact information for Dr. Nancy. We're also going to send you those notes that she read off of, and we really appreciate you taking some time out of your life to share with us about this postpartum care.
Thank you, Paul. It's been my pleasure. Thank you for all the work you do, too.
All right. Take care.
You too. Namaste.
There you go. Woo!
Wow.
Loaded, huh?
Yeah, I was making lots of notes.
I know. I just, like I said there, I'll say it again. Her message about it's okay not to be okay.
Yeah, we're always saying that, right? It's everything we are and everything we're not.
Yep. And the beauty of BioTouch is you don't have to be okay to practice it.
Right.
You just do it. And that's what I liked at her beginning. The whole thing was based on support.
Oh gosh, yes. That
Support.
was the first thing I wrote down. Support.
Yeah. And that's everything we've talked about for years about BioTouch, especially getting it into the family.
Oh my gosh. Is this not the perfect way to introduce it into the family?
Yeah.
Well, we know even pre labor,
right.
During the gestation period and
right.
during
prenatal
and
care, yeah.
everything.
And if
Yeah.
you have children in the family, getting them there. And we've always talked about too, in relation to what a unique, empowering statement for the parents to say to their children, which is, "Mommy needs your help."
Yeah.
To your 8-year-old or your 20-year-old, "Mommy needs your help. Daddy needs your help.
That's right.
And here's a couple of little sets of points you can do to help me." I mean,
It's perfect.
I just got so inspired by her talk.
No, it was, she said so many things that were so, some of them, having experienced it myself, I'm like, oh, wow, I did not, she brought up so many things that were, simple to understand, but at the time, you don't even think that you're going through some of this stuff.
Right.
All the cellular memory and the this from your childhood. And now here you are giving birth. And oh my goodness, I never thought about it like that. That was
Well,
great.
we have a certified practitioner instructor who's get a chance to practice it from beginning to end. Our dear Kai,
That's right.
I'm making it public now.
You bet.
She.
She's going to be our poster.
Yeah, our poster child, our poster mom,
Poster mom, yeah.
prenatal, postnatal, getting her husband Matthew in there to work with her.
Absolutely.
She's got her mother who made an amazing contribution in honor of Kai's pregnancy.
Yep.
So she's going to be the beginning of a movement, of a revolution of mothers and families with mothers of doing BioTouch.
I think so. We're going to be watching.
We're watching.
No pressure, but we're watching.
We're going to be putting cameras in that house. We're going to go 24/7 live feeds. Oh, now that would make it.
How about a BioTouch reality show?
Yes, I like it. Well, the reality is we're going to now share with you the sets of points to do. And again, you can contact Dr. Nancy. I put the email up there. You'll get a email of this replay of this. So if you can't get hold of her, contact us and we'll get hold of her for you. But we now want to teach you the points.
Yes.
For those of you who don't know anything about BioTouch, we're going to start from the beginning. And Bev's going to take you through this as I play Mr. Techie back here.
Okay. You do your thing, I'll do mine here. So if you have your workbook handy, we're going to start with page 6 in the workbook. And just introduce for those of you who have been with us before and those of you who have the first time, let's just introduce you a little bit to what BioTouch is. And it's really basically a very simple light touch technique that addresses all types of health issues and conditions. It's like anything the body can manifest, BioTouch can address it. And here's the thing. You use these first 2 fingers to lightly touch another person on the skin. That's the definition of BioTouch. One person touching another person lightly on the skin. And this technique has 17 basic sets of points that you use to address all kinds of different health conditions. So that's just basically it. We always want to wash our hands first. And as you will see very shortly, give the greeting, and then wow, you can really get to work and give somebody this amazing technique. So let's go through a couple of bullet points here just to kind of introduce you a little bit. The first one is how easy it is to learn. This manual, it's been put together so that it's got an illustration and then really broken down into all of the specific instructions on how to use BioTouch for these particular points to address a specific condition. It's very easy. As we say, even children, especially children, they get it. They get BioTouch. We've had some children being certified that I've been honored to be a part of. It's just amazing. Children get it. I always say we need to be like a child when we practice BioTouch, because there's nothing else there but two human beings sharing this loving touch with each other. So it's very easy to learn for everybody and very effectively the first time. It's a complement to any healthcare program. We're starting to understand how really holistic BioTouch is, how integrative it is with anything you want to do, another modality, a specific diet you're on, any regimen that you're on with your doctor in terms of, pharmaceuticals, whatever it may be that you are doing. BioTouch is a perfect addition to that. It just enhances whatever you're doing and helps the body to just, go through this whole journey of learning. And sometimes, as we always know, brings an awareness to us that, oh, I need to do this now, or I better go talk to my doctor because my body's changing. So this is a very, very wonderful way to just contribute and add to whatever you're doing. So it's very complementary, very integrative. And we say it's holistic because BioTouch starts with that light touch on the body, but then over time, consistency has the ability to address all those other parts of ourselves. This is where the self-awareness comes from, and we can make different choices for our lives. Very wonderful. The next bullet, BioTouch has no levels of ability. Isn't that just a wonderful thought? No levels, no, you don't have to spend $1 million. You don't have to be sanctioned by any master. You just have to be a human being, because we all are effective and we all have this ability to help each other. So the first time that you use BioTouch, you will be effective for someone. And I've got to say, I don't know another technique where you can, in a matter of minutes, show someone how to do a specific set of points on you. And you're both going to be immediately entered into this relationship of healing. It's amazing. So this is why we know that it's meant for the family. Every single member of that family can learn it and practice it very, very efficiently, immediately. I mean, wow, it's amazing. So this last bullet requires no special preparation, belief, state of mind. There's no preparing. It's really getting the negativity out of the space, or, you can do all that. You can light incense, you can have beautiful music. That's lovely. But BioTouch is meant to just be spontaneous. So you can help someone in a moment, no matter where you are. Can help everyone no matter where you are. And you don't have to have a belief system. There is no philosophy. Again, it's just one human being in a moment being able to help another. That's the beauty of BioTouch. It's one of the magical things for all of humanity, that this is here to share with each other. Paul, is there anything you wanted to
I
add
was
before
just
we
going
move
to
on?
build on that last bullet point. As Nancy ended her show, and we just talked about it, it's okay not to be okay.
Yeah.
And it's okay not to be okay to help someone with BioTouch because of what you just said. Because there's no level, there's no belief system. And we just had the show, even jerks can do it. And I've shown that because I'm one of the bigger jerks on the planet. And you agreed to that.
I had to. I'm sorry.
So yeah, that was a good bullet point with that. So I guess we could just go on and start teaching some of the points.
Let's start teaching. And the first one, of course, that we always begin is with the greeting. The greeting is always given prior to addressing any other areas of the body. And it really does. It just like it's the key that turns, and so the door is open. The body, wow, it's like this big, here I am. You're about to get BioTouch. And so this harmony that is set up between the practitioner and the recipient is amazing. But always remember, wash your hands, always give the greeting. And then once you do that, Paul's going to show us the very short video. It's very easy, and here we go.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then, with the same 2 fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds. More than one associate may work with a recipient provided that all of the associates perform the greeting. If the associate or the recipient leaves the session, or if someone who hasn't done the greeting touches either the recipient or the associate, the greeting must be reestablished. Then the session may proceed from where it was interrupted.
And there we are. Now we've opened the body, and now we can begin to address some of the other conditions that we might want to help with. The next one we're going to teach you is the stress and anxiety and shingles set. And I was thinking about this when she was talking about the support that the mom needs. And it's on all those parts of ourselves that I was talking about, the emotional, the mental, the physical support, but also that overwhelm that happens, the stress and anxiety. This is, as she was saying, dad needs some of this too. So BioTouch is so perfect for mom and dad to help each other. And then of course, let's not forget the bonding that happens with the baby. I mean, so perfect. So this stress set is really made for all of that support system that mom's going to need, and helps her to deal with this. Let's face it, your life has changed. It'll never be the same, you know? So let's go and let's teach you this amazing set, the stress set.
The stress set may be used to address any manifestation of physical, emotional, or mental stress, as well as anxiety and shingles. Hold at X, which is in the fleshy area just below the bottom of the breastbone. It is the same as greeting point 1. Then with the other hand, touch points 1 and 2, which are the same points as in the heart set. These points are found by imagining a line running from the notch at the top of the breastbone to a place on the left breast where the nipple would be on a youth. Divide this imaginary line into thirds. Point 1 is at the top of the first third. Point 2 is at the top of the second third. These points may be touched repeatedly, and remember to touch each point for at least 6 to 8 seconds.
If you do nothing but the greeting and the stress set, you're just beginning this amazing support for the body. So we're going to go to the next set that is very, very beneficial, the metabolism set. I remember Dr. Aton speaking about this hormonal imbalance and the thyroid imbalance. The metabolism set is used to help the body to regulate, to assimilate what it needs and what it doesn't. So this is a very important set for mom that can help the body rebalance some of that. So let's teach you the metabolism set.
The metabolism set can be used to help the body assimilate what it needs and eliminate what it doesn't need. The metabolism set has 2 steps. Step 1 involves touching points in matching fire along the large muscles on the front of the neck. Points 1 and 1 are located above the collarbone in the soft indentations on both sides of the notch at the top of the breastbone. Points 2 and 2 are halfway up the neck on the front of the large muscles. Points 3 and 3 are at the top of the neck on the front of the large muscles. The second step involves holding a point on the front of the body and touching points next to the spine on the back. Hold point X on the front of the body is on a line directly between where the nipples would be on a youth and is 1 to 2 inches to the left of the breastbone. Another way to find X is 1/3 of the way up the breastbone from greeting point 1 and 1 to 2 inches to the left of the breastbone. The points on the back are located next to the spine, forming a rectangle around the breakover point. The breakover point is where the bottom of the rib cage joins the spine and can be found by imagining a line directly through the body from greeting point 1. To perform step 2, find hold point X on the front of the body and touch points 1 through 4 on the back. Point 1 is approximately 1 to 2 inches up from the breakover point on the left spine muscle. Point 2 is directly across from point 1 on the right spine muscle. Point 3 is 2 to 3 inches below the breakover point on the right spine muscle. Point 4 is used to address blood sugar problems and is added to the other metabolism points when needed. It is located across from point 3 on the left spine muscle.
I would like to add on that there's a lot of prenatal, some women experience prenatal blood sugar issues. The metabolism set with that 4th point is very, very awesome for the mom. So there is that before and after birth.
And I just wanted to be in the background here saying, these 2 pages on each set. The first one shows a picture, a drawing, and that second page are the words, exactly the same words that are in the video. So it's easy to learn all 3 ways.
Absolutely. Yeah, the manual setup, so it's perfect for that. So yes, thank you. The next set we're going to teach you is the headset. And, this is something is very, very beneficial for anything that relates to the brain. And Dr. Nancy was talking about, the depression and some of these hormone imbalances that happen. And this is a perfect set for all of those kinds of things. It just really helps to body takes a breath in this. So let's go ahead and teach this headset.
The headset can be used to address conditions related to the brain. There are 4 steps in this set. In step 1, use through fire to touch points A and A. Point A on the back of the head is in the center of the neck at the base of the skull. Point A on the front of the head is at the center of the forehead where the forehead begins to curve to the crown. Step 2 is performed in crossfire with the fingers of each hand touching on opposite sides of the head. Hold at X, which is in the indentation beside the neck muscle at the base of the skull. It is the same as point 1 of the back set. On the opposite side of the head, touch points 1 through 5. Points 1, 2, and 3 are on the ridge line formed where the skull curves up toward the crown. Point 1 is above the outside corner of the eye on the ridge. Point 2 is above the front of the ear on the ridge. Point 3 is above the back of the ear on the ridge. To locate point 4, move down the head toward the base of the skull to a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear. Point 5 is opposite hold point X at the base of the skull. Point 5 now becomes the new hold point as points 1 through 5 are touched on the opposite side of the head. In crossfire, touch point 1 above the outside corner of the eye on the ridge, point 2 above the front of the ear on the ridge, point 3 is above the back of the ear on the ridge. Point 4 is a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear. And point 5 is opposite hold point X at the base of the skull. Step 3 is performed in matching fire, touching points 1 and 1, 2 and 2, 3 and 3, 4 and 4, 5 and 5. Finally, in step 4, place the open palms of both hands on the head covering points 1 through 3. Be careful, don't let your hands touch each other.
And there we are with the headset. And as we know, boy, that's one of those aha things that people have sometimes. It's very, very effective for depression and all those hormonal imbalances that she may have. So the last set we're going to teach is the lower abdomen set. And this is a perfect set for prenatal, postpartum, because it involves all those reproductive organs. And so this is, as we know, BioTouch is very effective pre-surgery or pre-natal and then after. So it helps the body to go, to really readjust itself. So let's go ahead and learn this wonderful set.
The lower abdomen set may be used to address any conditions or organs which are located between the navel and the pubic bone. This might include conditions of the reproductive organs, the colon, the bladder, or hernias. When working on the lower abdomen, it is helpful to press firmly into the flesh. But while working firmly, be careful not to cause discomfort to the recipient. The lower abdomen has 3 steps. Step 1. Locate hold point X, which is on the pubic bone. Do not press firmly on this point. While holding X, touch points 1 through 5 with the other hand. Point 1 is located just below the navel. Point 2 is in the soft tissue to the inside of the pelvic bone, low on the abdomen. Point 3 is the same point on the opposite side of the body. Point 4 is in the soft tissue just inside the high point of the hip bone. Point 5 is the same point on the opposite side of the body. Step 2. With the palm open and flat, slide the entire hand under the recipient's body and place the first 2 fingers of this hand in contact with point T on the sacrum triangle. Then with the other hand touch points 1 through 5 and X. Point 1 is located just below the navel. Point 2 is in the soft tissue to the inside of the pelvic bone, low on the abdomen. Point 3 is the same point on the opposite side of the body. Point 4 is in the soft tissue just inside the high point of the hip bone. Point 5 is the same point on the opposite side of the body. And X, which is on the pubic bone. After completing this step, enhancements in local work may be performed wherever a recipient is experiencing difficulties of any kind. Step 3. In matching fire, touch points 1 and X, points 2 and 3, and points 4 and 5.
There you go. Good
There
job.
you are.
Good job, Bev.
Good job, Paul. You did your part. You know, I just want to emphasize that the operative word here is family.
Yeah.
Mom has just had a baby, but there's dad too.
Yes.
And this is the beginning of this family practicing this loving thing together. It's just amazing. I'm so excited to have had Dr. Aton with us today.
And that I like that about this lower abdomen set, a guy working on a guy, and just reminding us even what Dr. Nancy said, that men have this postpartum depression, and it could be hormonal. And so,
Exactly.
having somebody do it and getting your buddy to help you do it, it's like that video clip I showed from the guy who worked on his buddy at the office,
Oh gosh.
and he just wanted to be able to help. And so, you got your friends, you got your neighbors, you got your family, and BioTouch works for all of it.
All of it. Well, as we have said many times, BioTouch has the power to break down barriers, those old barriers that says men don't touch men
Right.
and all this stuff. Well, guess what? Human beings touch human beings.
That's right. And our
Period.
goal
BioTouch.
here is to get that out. It's a revolution of love.
It
And
is.
we have numerous ways to learn that through these workshops. Please pass this on to your friends and family, especially if you know somebody who's going to have a child, some family. You can download for a month the workbook that you just saw with Bev for free. Just go to justtouch.com/workbook. And for a month, that will be free on the Postpartum Care. After that, you can download any of our workbooks. I think there's like 48 of them now or something.
Something like that.
Yeah, and those are for members. Download them anytime you want for free. For just becoming a member for $18, you get the entire manual in an ebook version and the ability to download all the different workbooks that we have developed. Also, go to our website, and there's a whole drop-down menu of different conditions and different presentations we've had throughout the year, and we just keep adding and adding and adding. So
Well, I can just say, not only are you going to be a member of this amazing organization, help us share BioTouch in the world, but you are, for $18, you're going to create this toolbox that you're going to be able to help anybody in your life with BioTouch
Yep.
to change their lives, change your life.
So I was also talking to somebody about the fact that we don't charge really, and that we're giving this away to humanity. He goes, God, you really are a revolutionary.
Yes, you
and,
are.
And we are. The whole foundation was set up to be a revolutionary concept in giving people back their birthright to be healthy, happy, and loved, and letting people support us in any way they can. So there's a donate button here. You can go to our website and donate. If you can give $1 or $1,000, it all just goes into the pot, because none of us are getting paid to do this. We just have a desire to get BioTouch out there to humanity.
I was going to say, that's our payment.
That
right?
is our
Just
payment.
to be a
That
part
is.
of the revolution of love.
Right.
That's our payment.
Just do it, and that's the greatest payment we could get. So we also want to share with you next month's workshop, which is going to be, I think, beyond awesome.
Yeah.
And what we have is, it's right somewhere. Here it is. Childhood and adolescent isolation. We have Brad Hunstable and Gary de Rodriguez. And I'll tell you, Brad's story is incredible. From what we've heard, his this year, his son committed suicide after it was a lockdown situation. I think just before his 14th birthday. 13th birthday.
13th, yes.
So Brad's really out there trying to get information out about adolescent childhood isolation. And he's hooked up with Gary, who is a mover and a shaker, who sets up programs, has been doing it, for decades, to help people come to terms with their own self-awareness, their own inner nature, and how to change the outside world. So he and I talked, and there's some things in the pike there that are going to be amazing in working with Gary. So we're going to have the two of them and the two of us. I think we're going to have an interesting little dialogue.
I'm looking forward to meeting and talking with both of them, the four of us. Yeah.
That's September 24th, same time, 6 p.m. How does it? Creek don't rise or the river don't rise.
Right. That's the plan anyway.
So
plans.
We appreciate all of you joining us. Please pass this on. If you want to get this in an email, let us know. Go to our website and just click join. Just get the free. You can get the free 10 pages too. So we just want to get this out there. Bev, awesome job. I always appreciate working with you.
Yep.
So we'll see everybody on Monday. We have a special guest on Monday, but we'll see you otherwise next month. So bye-bye, everybody.
Bye. Thanks for joining us.